Let's say recording in the top left for you.
Yep. Yeah, it's recording.
All right, perfect. All right, my name is Nick Eggert, and I'm part of the UWEC COVID-19 Archive Project. Today is 5:19, and the time is 3:07 in the afternoon. My first question to you is, what is your name?
My name is Trent Jansen.
Okay. And do you mind sharing demographic information for the study?
Nope, that's fine.
All right. So then what is your race?
I am white.
All right. And your ethnicity?
Italian.
Okay. And what's your age?
I am 25.
Okay. And gender?
Male.
Okay. What are some of the things that you do on a day-to-day basis?
So I am in telecom sales. So being in sales, my job is to work with my customers on, daily projects, whether it's, selling them new products or solutions, going over any billing issues they may have, any outages. That's kind of the day-to-day stuff.
And outside of work, what do you primarily do?
A lot of fishing, hunting, hanging out with friends.
Okay. Where do you live?
I live in Minneapolis, Minnesota.
And then what is it like there?
As far as now, you're saying,
Mm-hmm.
compared to the normal? Um, we've gone downtown a couple times, and it seems to obviously be a lot less busy. Some of the skyways, they shut down. Some of the parking ramps, they shut down. So the actual city's, a lot more quiet. As far as where we live, there's a big lake right around us. And on these nicer days, we've gone out on some walks, and there's actually probably just as many people, if not more people, walking around the lake, exercising, being, close to each other. So from that perspective, it seems pretty normal.
All right. When you first learned about COVID-19, what were your initial thoughts about it?
I thought it was a little bit of an overreaction, with how dramatic the shutdowns were. I understand that it is a very scary time and a scary virus just because we don't know so much about it. So I understood that perspective, but it was just very odd to obviously see everything shut down, because that's something that's never happened before.
Mm-hmm. And have your thoughts changed over time about it?
Yeah, I'm to the point where I just think that everything needs to be completely reopened. I think that if you are in one of the categories that prove, that's been proven that you're at a higher risk, whether, of your age or because of, different conditions, then you obviously have to continue the social distancing, staying at home as much as you can, or even if, you're not in that category, if you're hanging out with, whether it's relatives or friends that fit in those categories, then you need to take it as serious as possible. But I think for the greater society, that they should be able to be given the choices to go back, and I don't think that the shutdown should be happening anymore.
Mm-hmm. So what are some issues that most concern you about COVID-19 then?
Um, Personally, I haven't worried about getting this or getting super sick, knock on wood. But, my biggest fear would be giving the virus to somebody, whether it's my grandparents, my parents, or even a friend, and then them getting sick. That's kind of my only personal fear of it.
Mm-hmm. All right. I'm going to switch up the topics here for this going forward. How has COVID-19 affected your job?
So for my job, luckily beforehand being in sales, it's a lot of remote, a lot of customer visiting, and not necessarily having to be at a corporate office. So from that standpoint, I was already able to work at home kind of whenever I needed to or wanted to. So that hasn't really changed much. I'd say the biggest change is not being able to meet with my customers face to face, whether I'm going to their offices or going to lunches with them. So that's been kind of challenging. And then also, obviously, now taking a lot more video calls rather than, like I said, meeting them in person or just calling them on the phone. It's hard to get a good reaction on a product or a solution from your customer just by their voice. Obviously seeing facial expressions is a big part of you reading, where they're at with the solution. So that's changed a little bit.
Mhm. Have you ever been at fear of not being able to work during COVID-19? Like, was there any initial thoughts that you weren't going to be able to work?
Um, no, not specifically. I think the biggest thing for us was, like I said, being in sales, we're, always kind of remote, always going out to the customers. But some of our internal, resources, I worried about as far as, getting answers that we need back quickly. Whether it's, like I said, it could be a billing discussion or issue. It could be, an outage. Having, how quickly could our field techs get on site with everything going on. So that's been the most, I'd say the most impacting on my job is just getting other resources from people that are normally, working from an office.
And then do you find yourself working more hours out of the day when you're at home? Is it hard to distinguish work hours?
Yeah, I would say so. Starting the day, obviously there's no real prep time. You don't have to get all dressed up. You don't have to drive downtown. I don't have to find a parking spot and, walk pretty far to get to my office in the city. So from that perspective, obviously, you don't necessarily have to start as early. But if you're used to getting up, you kind of jump on the computer, a couple minutes early, 30 minutes early even. And then as far as later in the day, I would say working more, just, easy. I have everything set up. So if I need to do something or something comes to my mind, I kind of uh, just want to get it done right away. Compared to when, I was going downtown, I'd try to shut the computer after, left for the day and just leave it off. So yeah, I'd say I was working a little bit more just because there's no travel times and you kind of work through your lunches. You're not interacting with other people in the office. Even if I wasn't at a customer lunch, I'd look to see who's in the office and go get lunch with them, for an hour 15. And now you're kind of just, I've been skipping lunches and you just kind of work through it. There's always fires or big priorities that you're trying to, work on, whether it's internal or with your customers.
Mhm. And you talked about a little bit of your coworkers. How's the atmosphere going around for your company?
Um, it's pretty good. They're trying to do all they can to keep it as normal as possible. So we do. I mean, there's a lot of opportunities, whether, they try to do like team walks where, you don't have to call in or be on your, face screen, sharing your screen, but just trying to set up time to make sure, people are still going out, taking their 30 minutes or hour of a break at lunch, doing, try to do happy hours virtual, which, I joined a couple. They don't really do much for me, but, I understand the purpose of them. And then just a lot more meetings over video. Like I said, even without customers, even if it's just, team meetings, just to try to, get over the fact that we haven't been in the office for quite some time.
Mhm, mhm. you talked about those happy hours. How has COVID-19 affected your social life?
Um, quite a bit, with work and even outside of work. Just not being able to go out to restaurants and bars, even just have a drink or two or have appetizers. Um, that's kind of a big part of my life with work and then outside of work. So, obviously have not been able to do that. So that was a big change. So for the most part, we've just been, you know, eating at home, going grocery shopping once a week, um, and, very rarely ordering out.
Mhm. Okay. Um, how has COVID-19 affected anyone, like employment of people that you know?
Um, for the most part, I'd say I'm very lucky, and most of the people I know have been lucky with not losing their jobs, because I know that's been a very big impact for throughout this whole thing. But I do have a couple friends that were furloughed for the time being, just because obviously when company doesn't have customers anymore for the short term, like it's hard for them to continue to pay their workers. So I've seen a little impact um, that way.
Okay. All right. All right. I'm going to switch up the topics again here. How has COVID-19 affected you and your family's day-to-day activities?
Yeah. So for my personal family, I have not seen them. They're taking it, I'd say more serious than myself. So they obviously want to wait until there's more guidance on where the whole virus is at, and what other steps they could take to be cautious with it. So I've just been texting them, trying to FaceTime them, talk to them as much as I can. So I've not seen them at all. But for myself, still been doing the stuff I like. Luckily, fishing and hunting for the most part, you're pretty isolated to begin with. So I'm able to still do those sort of things on my own.
Do you find yourself more like on the internet and social media?
Um, I'd say debatable. I'm always kind of on my phone, whether it's work, responding to emails, or just like you said, screwing around on social media. I'd say I'm paying attention and watching the news a lot less, because I mean, every social media outlet, every news, station is spewing different facts that they call them facts, but different statistics. And it's just all depressing stuff. It's like you might as well just push that aside, and that's kind of what I've done.
Okay. All right. This is kind of more of a fun question. Have you challenged yourself with any new skills?
Hmm. Any new skills? No, like I said, just been obviously cooking more. I haven't gone to restaurants, so just been trying to learn some new recipes and do a little more cooking.
Okay. Um, so you said that you haven't been really in much communication with your family. Have they been doing okay with the COVID-19 pandemic? Like how?
Yeah, they're fine. They just don't want me to come visit, because I've came in contact with a lot more people, and have taken a couple trips right at the very beginning of this whole thing. So understand, you'd rather be safe than sorry.
Mhm.
But for the most part, they've just obviously kind of listened to what is being told, and kind of stayed isolated at the house.
Okay. All right. What normally did they do like at home? like for recreational things that they seem to be not able to
Um,
do?
not, I mean, honestly, not much. Say parents, some gardening, and then, I know that they've been trying to go on walks. But I mean, as far as my younger sister's brother, they obviously don't enjoy not being able to go hang out with their friends, go to the mall, do the normal teenage, preteen stuff. So,
Okay. All right. Um, so you also said that you live in Minneapolis and the Twin Cities. How has COVID-19 affected that community?
um, yeah, like I said, as far as I think at the beginning, it was more impacting. Everyone took it super serious, and actually, the governor of Minnesota even said, like, originally Minnesota was given an A rating for their social distancing and, how they were reacting to this. But I think it's gotten to the point where people are kind of just like, I want to make my own decisions. If I want to risk this at this point, that's my choice. And he said that this past week, Minnesota was given a D for that same rating that they got a month ago. So like I said, I think everyone here is really just ready to get back to, how things were. And, if you want to play it safe and stay in and keep practicing social distancing, that's great. But if you, want to get back to your daily life, I think that should be your choice. And then obviously, each of the businesses are going to have their own way of getting back to their new normal, however that looks.
Hmm. Hmm. What precautions have you and your family taken against like going out?
Um, the biggest thing I'd say is I normally do my grocery shopping Sunday mornings at 5 a.m. once the grocery store opens. So, I'm the first person in there, hope that helps. Hope that's, right after they just cleaned everything and there's, not many people in there. Other than that, not much has changed. We've always carried around hand sanitizer, wash your hands, the basic stuff that you'd think most humans would understand, but they don't. So, and from that perspective, nothing's really changed. Um, we try to just avoid going to the stores as much as possible during busy times, unless absolutely needed.
Okay. Then do you find yourself able to find everything when you're out shopping?
Obviously all the stuff that was, mentioned all over the place with toilet paper and Clorox wipes and hand sanitizer, and it was this huge deal. But I mean, for the most part, we find everything. I'm able to find Clorox wipes to Lysols, those things if you go, first thing in the morning, and obviously now that stores have to limit everything to one per person or whatever they decide, um, that helps a little bit. um, but yeah, for the most part you could get everything you need.
Okay. Have you seen people around you change their opinions or day-to-day activities in the pandemic?
um, I mean, like people that I personally know, I mean, a little bit, like I said, they're more cautious at first, and then at this point they're starting to be like, okay, like, let me decide if I want to go, you know go out to a restaurant. Let me decide if I'm gonna go see my friends. Uh so personally, I'd say, they're, like I said, cautious at first and now ready to get back to normal. As far as other people I've seen out in stores or outside, I've obviously seen people change and they're stare you down or don't want you to come near them, or you have to sneeze or you have allergies and they think that you're like passing all these germs. So I don't know, it's like I said, I think some people, if you're gonna be that into it or that worried, then maybe you should just stay inside and have others go shop for you.
Mm-hmm. Has COVID-19 changed your relationship with family and friends in the community?
Not really. For the most part, it's pretty standard. Before this, I talked to my family, even though they're um, pretty far away. I don't necessarily see them all the time, but we still text all the time. We still FaceTime. We did all that before, still do today. And then obviously things shifted a little bit being in an apartment in Minneapolis with my fiance. So then both of us working at home, we just had to get used to that. Having our own space, own rooms during the day. But like I said, trying to avoid changing anything else.
Okay. Right. Have you known anyone that's gotten COVID-19?
I do not.
Okay.
I know people that say that they think they had it, but then you ask them if they've been tested and they say, well, no.
Okay.
So I think that is also could be an issue with false reporting on numbers, but
Okay. Then in what ways do you think like COVID-19 is affecting not excuse me, is affecting people's mental and physical health then?
I mean, I've heard it in, I've heard, a bunch of stories, just how, it's just proven that the mental health, has really gone downhill with all this being forced inside and not being able to see people. And then, like I talked about, people letting this, idea of a virus take over their brains, which is pretty sad and scary. But obviously suicides continue to happen and they keep going up, and it's just horrible. So obviously I think that is actually the mental health piece of it is more deadly than the virus itself. And I think at the end of this, when like I said, you look at the suicides compared to the deaths from just the virus, it's going to be overwhelming, deaths caused by the mental side of it, which is, just horrible.
Mm-hmm. Mm-hmm. And yeah, it's been one of the darker times. They talk about it almost being as bad as like the Great Depression and that
Mm-hmm.
area.
Yeah, and
Um,
and the depression's just, like I said, getting worse. I think the longer this lockdown, is taking place, and obviously then hospitals are trying to avoid people coming in for COVID related cases, which, to me, having mental health issues because of it, is just as bad, if not worse. So I just don't think people are, able to get the help that they need from a mental health standpoint, which is obviously, like I said, leading to a lot more, unfortunate suicides.
mhm. All right, I'm going to change the topic again. Before in the interview, you were talking about news stations and how you've been following along with the news during COVID-19.
What do you mean? How have I been following along?
What primary sources have you been like looking at?
I mean, for the most part, I look at all the news sources, whether it's to get a laugh or to just hear all the different sides of it. But like I said, at this point, I'm kind of just over it altogether with any statistics, just because, there's so many unknowns that I just feel like it's unfair for the media to be pushing it out to, everybody when it's most likely not true with what they're saying to a certain extent. And like I said, I think they're really just at this point, almost scaring the society more than giving good advice. So like I said, at this point, I'm just kind of, if it pops up on, on Facebook, or if I see, something on, a news app, I'll read it. But other than that, it's like I'm not going out of my way to turn on the news to hear the same story over and over and over again all day on every news station.
Mhm. Do you think there are any important issues that they're like not covering or covering?
Yeah, like I said, I think they need to stop scaring everybody. I
Okay.
mean, the whole thing is just, you know, and I've talked to a lot of people, maybe my age that are kind of in the same boat as myself, as far as kind of, you know, not over this because, I get it's still here. It's still like a real thing and people are still dying. But like I said, when you compare it to, mental health issues that it's causing, businesses, unemployment that's causing, like, you know, what's the lesser of two evils? But, I think the media has just done such you know, a horrible job. And, maybe to them it's a good job, but scaring a lot of the older folks in the communities,
Mhm.
to where, they don't think they could even step outside, which is just kind of sad.
All right. And I'm gonna switch this to more of like a governmental view of it. How do you think municipal leaders and government officials have been covering COVID-19 or responding to it?
Um, I don't know. It's been kind of interesting to see how all the fingers, could be pointed at, the highest level, the president. But then now it is, it's a state level of, how they want to handle it. And now looking even, closer at it, now that like Wisconsin, for an example, it was rejected. They had to open back up, but now it's down to a mayor level, the mayor of Milwaukee keeping them shut down. So it's just been kind of interesting to see how specifically, at each level of the government, they've been able to kind of control, our lives to a pretty heavy extent, which, looking 6 months ago, there would have been no way I would have believed that would ever have happened. Um, so, so yeah, I mean, overall, I think we did what we could with the limited amount of um, time we were given to really be told how bad it was. And um, again, I think at the end of the day, I mean, the finger pointing shouldn't be, there should be no finger pointing at any of our government, whether, it's a Republican state, Democratic state. I think the finger pointing should be at where the virus came from, China. They knew about it, and they, played it off, absolutely devastated Italy, devastated Spain, the countries, closer to them, and then, let it continue to circulate and get around all these countries before, we were really able to, look at what's the best way to shut down the borders, what's the best way to get prepared for this, because we know it's coming. So like I said, whenever someone wants to, argue about, um, how they think someone in our government handled it wrong, it's like we should really be looking at how the Chinese government handled it wrong.
Mhm. Mhm. I know there's a lot of debate going on about our responses to the whole COVID-19 and foreign. But now that it's coming to, I would say people are saying it's coming to a close. How do you think the country, or sorry, I'm going to rephrase that. How do you feel about the country like reopening now that it's on the downturn towards this?
Yeah, and the thing is, I don't even think it's necessarily on a downturn. And once there's reopening, the cases are going to spike back up. It's just seriously, it's a given. And until there's actual tests that show how many people have already got the virus, and already beat it without any symptoms, and to really determine, what is the actual, mortality rate of the virus. Um, it's kind of hard to determine or put it into, a fair table of, balancing and, looking at the pros and cons of, like I said, deaths by just the virus, or deaths by because of all the mental health issues that it's caused, all of the economic hardships it's caused. Those are leading to, like I said, more deaths for a fact. um, so like I said, you hate comparing lessers of two evils when it comes to American lives dying, because you never hope it comes to that. But like I said, it just you can't keep the United States closed down. I mean, just the amount of pain that causes on outside of just our country too. It's too much. Um, like I said, I think that the death rate, as we learn more, as more testing comes out, um, I think we'll find out that the mortality rate of COVID-19 alone, being the standalone cause of someone's death, is going to be so much lower than originally anticipated.
Mhm.
And I think even looking at all the government charts, and I know those are just estimates, but every one of them, it's been way lower than what was originally anticipated. And like I said, I know with reopening, it's going to cause more cases. People are not going to be smart about it. They're going to rush to the bars. They're going to want to go to concerts. They're going to want to, do all that. And I think you just have to be more open to some of the changes that are obviously going to happen. But just be smart. Wash your hands. Everywhere you're going. Don't go near huge groups of people if it's unnecessary. You don't know them. But like I said, we really need to reopen the country. I don't think that we could do this any longer.
Mhm. Mhm. All right. So my next set of questions are going to be looking out towards the future more and towards yourself. Has your experience transformed how you think about your future career plans, or about handling money?
Um, you said about handling money.
Um, so yeah, so let me just say that again. Has your experience transformed how you think about your future career plans or about handling money?
Um, Not so much future career plans. Um, but I mean, as far as money, like I said, not going out to restaurants, to bars, doing all that, saved quite a bit of money, but also put it in perspective as, you know, you asked anyone if this event would have happened 6 months ago, they would have said there's no way that's possible. So from that perspective, it's yeah, I want to start saving more money. You can never have enough. You never know what's coming next. Like I said, whether it's virus, whether it's job loss, whether it's sickness, you just can't be over prepared for something like that. So I think from that perspective, just wanting to be as conservative, save as much as possible, just to always be prepared as much as you can for something.
Hmm. Um, and before you talked about like sporting events and going out, are there any things that you took for granted, such as attending those sporting events or large concerts or restaurants, and think anything
Yeah,
different about them now?
yeah. I went to some sporting events. Went to a lot of baseball games, went to some football games, hockey games, but um, you know, I think the biggest thing for me is even just being a big sports fan and seeing I guess the only sport on right now is UFC fights, but it's just even weird seeing those events going on without the atmosphere of fans in the crowd and cheering, and thinking about the NFL without fans in the stadiums, or baseball. um, you know it's just really odd uh, from that perspective. And then, more personally, obviously, like I said, went to way more restaurants and than I did go to sporting events. But that's definitely been kind of the biggest change. And, like I said, as the restaurants open up, they're going to, I think, try to put in new guidelines, whether it's government, necessary, or they just want to prove to their communities that they're, doing what they can to keep people safe. I think that may change a little bit, but yeah, other than that, like I said, it's just been really odd not being able to, after work, go grab food somewhere, sit down, um, you know, just have that ability to be somewhere outside of, just your home.
Okay. Right. Do you think anything differently now about large crowds and like public display of affection?
Um, Not really. Like I said, I think it's your personal decision, but I mean, when I think about a large crowd now, like I said, I think how sad it will be if that's no longer allowed at sporting events. Stadium, you can't have people 6 feet apart during a concert. You can't have people 6 feet apart during a football game, and just what that does. As far as, like I said, the atmosphere of these big events, these big revenue events. Um, so like I said, I think it'll be interesting to see these next couple months and how these sports leagues decide to move forward, with all of this.
Mhm. How long do you think the pandemic will last?
Um, you know, will it ever really technically end? I guess, what do you consider it ending? You look at, you know, other viruses, uh, the flu, it's like it's always still a thing. Each year, so many people still get the flu, so many people die from the flu, even if they're getting the vaccines. So I guess it really determines on, what do you consider it being, over? Obviously we're trying to push and rush these vaccines now, but how many vaccines actually, get rid of it altogether? It could always be changing, mutating, into different forms of the virus. Um, so I guess, you know, from that perspective, like I said, I don't know when you'd consider it over. Um, but I think, like I said, once we have more concrete evidence on, hopefully a lot lower mortality rate than, what's been spoke, to the society. At that point, once the fear levels, hopefully go down, we could take that as a win, as, it's over, but, it's still, around the world. It's still a real virus. It's still killing people. Um, so yeah, I guess that's my take on that.
Okay. All right. I got one final question for you. COVID-19 is kind of a dark and kind of depressing topic. Is there anything that you can think of a positive effect or outcome of the pandemic?
Yeah, like I said, I didn't necessarily see my direct family a ton because I am working out of a different state than they're in. But just how important family as friends are. You see people doing these Zoom calls, doing these FaceTimes with people that maybe they actually haven't seen in even longer. But it's trying to bring people from, and even the economy standpoint of it. I think it's interesting to see how businesses are going to react after this. Just on, there's so many jobs that were always, these are jobs that you have to be in an office doing, and then they're all forced on a flip of a switch to turn them all into remote jobs. So I think that will be kind of interesting, and maybe it's a positive. A couple of years from now, once everyone, hopefully the unemployment rate gets back down, and more businesses start opening up. So obviously that's not a positive. But like I said, it would be interesting to see sort of how much more people can possibly work from home, because I know that's a definite benefit that a lot of people don't have today and haven't had. but would like to have more freedom to do going forward.
Okay. All right. Well, I'm all out of questions. Is there anything else you'd like to say for people about COVID-19?
No, I think you covered the questions. Like I said, I'm just hoping that it wraps up here to, a certain extent. Like I said, obviously this is going to be a lingering virus, a lingering issue for, probably years to come. The economic, you know, effect it's going to have, on so many people, will last for a long time. So I just really hoping that, the government as a whole kind of, stops the divide to a certain level, and, actually is just focused on solving this one issue, and, stop looking at, other issues and trying to group them all together, and just really, focus on the people and how we could, start saving more lives, virus related, mental health related, get people working again, that unfortunately were furloughed or lost their jobs, and kind of go from there.
Okay. All right.
So
I appreciate you taking the time out of your day to do this interview with me.
Yep, no problem.
And I hope everybody in your family stays safe and healthy during this time. And
Yep, you as well.
thank you again. And have a great rest of your day.
Yep,
See ya.
you too.